My name is Dr. Jonan Stusemire. I'm a pharmacist and a senior lecturer at Bahr University of Science and Technology, but I'm also a member of the Education and Grants Committee of the Pharmaceutical Society of Uganda. Our project is called SUPACT. SUPACT stands for Supplements to Artemisinin-based Combination Therapies for Malaria. And we are working as a team of 4 institutions. The lead institution is the Pharmaceutical Society of Uganda, which is based in Kampala. And we are also working with Jena Herbals Limited, which is a private entity also based in Kampala. We are working with South Sudan, that is the Universite of Bahr, Ghazal, based in Wau. And we are also working with the Universite of Bukavu, which is based in DRC, the south of Kivu. In this project, we are looking at the problem of malaria. From around 2005 up to around 2018, we saw a steady decline in the number of malaria cases and malaria deaths globally because of the artemisinin-based combination therapies. That is when drugs formulated with artemisinin in them gained worldwide use in clinical practice. But then from around 2018 towards the current state, we are seeing the cases going back upwards. So what is the problem? The malaria parasite is mutating, is changing. And this mutation has been documented, started around Southeast Asia, and is spreading globally. It's already in Africa. It's a point mutation on one of the chromosomes of the parasite that is causing this parasite not to be as sensitive to the drugs as it used to be. It means that what we are seeing in terms of the increase in the number of cases of malaria and in the number of deaths of malaria after 2018 is because of the resistance towards the current treatment, which is the ACTs, as I explained earlier. In our project, we are working with non-artemisinin derivatives of certain plants. And this is Artemisia annua, which actually also gives rise to the ACTs, the artemisinin in the ACTs. But we are also working with avocado seed extracts and lemongrass extracts. So we are looking at reversing the resistance or reducing the progression of the resistance towards ACTs by using non-ACT based extracts of these plants. We are producing a capsule and a powder for reconstitution for the children that contains the artemisinized extracts from Artemisia annua and other plants. I mentioned avocado seed extracts and lemongrass extracts that, combined with ACTs, have the capacity to increase their effect against the malaria parasite. And this has been studied. We want to study it further by isolating those de-artemisinized extracts, understanding what compounds are there and what effect they have on the parasite, and then formulate those components that are active into suitable dosage forms that can then be administered together with the ACTs to improve the activity of the ACTs against malaria. So the technology is within that scientific evaluation of these extracts, the isolation of the specific compounds that are there that have activity against the parasite, and then the evaluation both in safety in animals and in humans through a clinical trial, and then being able to package them and have them ready for use. We expect to achieve a reduction in malaria death and morbidity as a result of malaria, not just within the ESA, but eventually also globally. Because if we are able to demonstrate efficacy, then it means we can have these products recommended for use generally in all malaria patients. And once that happens, then it means we are reducing the progression of resistance. We are also reducing the effect that the resistance is having on the population globally. And of course, there are many other consequences. Increasing productivity of the human population by reducing the number of days that patients stay in hospitals or the days they spend without actually being productive. Creating jobs because these products have to be sourced from the different people that cultivate these plants, and then the supply chain, people will be employed. And if all this happens and eventually we see the effect on malaria reduction, then I think the project will have achieved its purpose.